Well, good afternoon again, and good morning to the Central Time folks. I'm Lori Reeves with the Florida Perinatal Quality Collaborative, and want to thank you for joining us for this brand new idea we had this year, part one of the Mother Focused Care Mid-Initiative meeting, which is an optional meeting. It's not a mandate that hospitals participate, but we wanted to offer it for a couple of reasons. Before I go into those, thank you to those of you who are putting your names and institutions in the chat box. We appreciate that very much. And while I'm thinking about it, please make sure at the end of the meeting you do our little evaluation poll before you sign off. And let's get started. So we call this shooting for the stars because one of the gaps that we see often among our hospital team members is having a really good understanding and feeling that they really know how to dive into and use the data associated with their hospital. Next slide, please. So what we're hoping to accomplish today is to give you guys some tools and opportunities to become more familiar with your data, maybe some tips and tricks that allow you to use it more effectively. And we'll dive into that in a couple of minutes. To get us started, instructions, please know this meeting is being recorded, so keep that in mind. We typically ask you to keep your video on. I would make an exception here to say that keep your video on if we're in a discussion mode, or if you speak up to ask a question. Otherwise, if someone is speaking, I think it's perfectly okay to leave your screen off. And make sure that you keep your microphone muted. We can mute you from our end if we need to, but we have to take some time to figure out who is actually responsible for the background noise before we can find the right person. So it's very helpful if you just double check right now and make sure that you're on mute. And then if you want to ask a question, you're always welcome to at any point. We prefer that you use the feature at the bottom where you can raise your hand. And that will enable us to call on you so that you can unmute and ask the question. Next slide, please. Oop. Go back. Here we go. Vision and values. We start every meeting with a review of our vision and values. And this is more true for Mother Focused Care, I think, than any other initiative that we have done in recent years, that all of Florida's mothers, infants, and families will have the best health outcomes possible through receiving respectful, equitable, high quality, and evidence-based perinatal care. And as you all know, respectful care is a core component of this initiative. So really important to this. Next slide, please. Over the next hour, we're going to talk about challenges and successes, and that's going to include helpful hints on how to do these things. We're going to look at how to identify disparities across populations and how to address data quality issues you may be having. We're going to look at how to implement the screening required by CMS for social determinants of health and ensuring that people who screen positive get appropriate referrals. We'll talk a bit about challenges related to staff education and training and family and community engagement. And then we'll review some action items for you to complete before the in-person meeting, which we call now part two. Please make sure that your hospital has 2 people registered for the in-person meeting. Participation in the pre-meeting, the part 1 meeting, does not replace being in person for part 2. So please remember that in-person meeting is a core measure for us. We need you there. We have some hospitals that have only 1 person registered, and we have a number of hospitals that haven't registered anyone yet. We know you've probably just lost track of it in your email box. We can put the link in the box before the end of the call so that you can still do that. Next slide. I want to introduce the speakers for today. Go back one. Oh, here we go. It's our data team, and you all know and love the data team. They have taken the entire meeting today, and it's all built around helping you achieve your stars, which are, we know you all want to get 5 stars and everything, and this is going to help you get there. So Dr. Rubio is our Associate Director of Healthcare Data, and she works with Benjamin Gessner, one of our statistical data analysts, and Shelby Davenport, our newest statistical data analyst. And with that, I want to turn it over to Dr. Rubio for the rest of the meeting.
Thank you, Lori. Good afternoon, everyone. I do have a wonderful team. And we are going to walk you through many of the things that we have identified as successes and challenges for the initiative. So this is a very great time for all of us to see where we're at. First off, let's just start with our aim. By December 2024, that's just 9 months away, each hospital will achieve a 20% increase from baseline in the percent of patients with a positive SDOH screen who are referred to appropriate services. And we also want to have at least 80% of our providers and nurses attend respectful maternity care training. So to make these goals happen, we identified 4 drivers. Remember those? That was data insights, respectful maternity care, universal SDOH screening, and family and community engagement in hospital QI work. So through the presentation, we're going to go through each of those drivers and see where we're at. So the first one, right? Data insight, understanding our data. We need to know who the mothers we serve are, what challenges they face, and what outcomes we're seeing. That means collecting information about things like their background, their social factors. We also have the Perinatal Quality Indicator Report, which is a great tool to help you spot any differences in outcomes between different groups. And once you spot those outcomes, those differences, we ask that your team gets together and puts out a written plan to address those identified gaps. So where we're at on that. You can see here, we are collecting 4 key measures for those things. We have about 85% of our hospitals already with an implemented process to map and collect demographic intake questions, which is great. 88% of our hospitals have a process to collect and correct patient self-reported demographics and SDOH data, which is also fantastic because we have found in many places, race, ethnicity especially may be recorded as one thing, and at some point you realize that's a mistake, so you need to have a process to correct that. We also asked how many hospitals have a strategy to answer patient questions about demographics and SDOH data. We want to make sure to make our patients comfortable, and if they have questions, that we have answers to their questions. And so far, 73% of our hospitals have that in place. Where we are having some issues is in the implemented written action plan to address health disparities. So far, we see that only 42% of our hospitals have that implemented. So there we need to get some work rolling. And today we're going to, first off, start with a poll. We want to know how often you have used your PQI report in the last 6 months. And I just launched the question. You can tell me I've seen that once, maybe 2 or 3 times, maybe 4 times or more, or I've never seen that. We just want to get an idea or if it's being used or not, and how often you use it. Gonna give it 5 more seconds and we're gonna close the poll. Thank you for answering. That is really, really useful. And I'll tell you, 100% of our maternity hospitals in the state are now part of PQI. Our process is that we send that report to your hospital PQI liaison. So that's one person in your hospital that is responsible for distributing the report across teams. So if you have never seen it, in the next couple weeks, we're going to ask your liaison to please send that to several teams that may need it, so you all can see it and use it. Awesome, wonderful. So most of you have it, most of you have seen it, very few of you haven't. So that is very encouraging. And today we're going to take a little time to go through what the PQI report is and how you can use it for MFC. All right, so we support hospitals' QI efforts by providing this periodic hospital-specific report of perinatal indicators and corresponding data quality reports. The huge advantage of PQI is that hospitals do not have to submit any data to us to get the report. We get all of that from available resources like birth certificate data and claims data. And the indicators have been very carefully chosen and adapted, following indications and measurement from leading organizations such as AIM, the Joint Commission National Equality Forum, and the Society for Maternal Fetal Medicine. So we know they are the most key perinatal indicators that most institutions are going to be following on. Please remember to mute your, okay, thank you so much. All right, so once you go into the report, once you get it, this is the list of indicators that you will get. I am not going to read through all of them, but you can see that there are very key metrics like severe maternal morbidity, hypertension, obstetric hemorrhage, and low-risk cesarean deliveries among them. These indicators provide great value and are very helpful for your clinical quality processes as well as to guide your quality improvement efforts. All right, so PQI has several sections, and here you can see we have a data quality dashboard, a hospital profile, a summary dashboard, differences in perinatal outcomes dashboard, and then we have indicator-specific graphs and reports that are going to go through variation, quartiles, time trends, and disaggregation. The report is very rich. It has 40+ pages, and it goes through a lot of detail to provide you a lot of information regarding these indicators. But for MFC, there are several sections that are key. The first one is the data quality dashboard. It's going to tell you if you have a lot of issues related to your quality, which may be impacting how you disaggregate in outcomes, either at the PQI report or at your facility. It also gives you a dashboard to assess differences in perinatal outcomes for these key indicators, and also provides opportunities to disaggregate your data by race, ethnicity, insurance, BMI, and maternal education. We're going to go through some of those sections. And the first one is the data quality dashboard, right? So in the data quality dashboard, you're going to have two graphs that are incredibly useful. The first one is the percent of unknowns. So here we know that certain patients may not have that information available, but when we see more than 5%, that's a problem. We had this hospital that in 2021, 2022, about 7 to 8% of their patients were marked as unknown for maternal race. But that was quickly corrected in 2023. So, you know, sometimes it's a matter of contacting your birth certificate clerks and making sure they are collecting their information in the right manner, so that one gets carried forward to your birth certificate data. There's other additional variables that are key, and we really ask you that when you look at your PQI report, if you find issues in any of them, you either work with your birth certificate clerks or the people that are reporting the medical variables in your birth certificate to make sure that that gets improved. All right, and then we also have the data quality dashboard related to agreement. So making sure that our hospital records have the right information about patients, especially their race and ethnicity, is crucial. When we compare what the patients report in the birth certificate versus what the hospital reports in the claims data, we see substantial issues. Ideally, if you think about it, it's the same patient. The agreement should be close to 100%. But that's not what we see. In some cases, we see those percentages to be as low as 50%. It's a big problem. So this hospital, we're going to take it as an example. The agreement for the patient's race is about 66%. That means about a third of the time the information in the medical chart is wrong, right? So other important information like ethnicity and payer details for this particular hospital is also low, about 89% and 80% respectively. We definitely need to fix this. We should have a process in place to correct mistakes when they're found. And we've seen that many hospitals have that in place, but some are still missing on that. So please, if you haven't worked on that, make sure that you work with your admission clerks and your IT department to have a process where if you find a mistake on race and ethnicity, that can be corrected. All right. So the next thing that is very useful for MFC is your differences in perinatal outcomes dashboard. The dashboard can be a little bit overwhelming, but don't worry, we're going to start small and then we're going to gradually expand our view until you see the whole dashboard. In this graph, we're looking at the percentage of patients with severe hypertension. That one comes from the hospital discharge data set, and you're always going to find the source for that information next to the name, right? So you can see exactly where this is coming from. In this graph, you'll notice different shapes. They represent different groups. Blue circles are for non-Hispanic, diamonds for non-Hispanic Blacks, and triangles for Hispanics. So visually, you'll quickly notice a gap between non-Hispanic Black patients and others. And that indicates clearly that there's a higher percentage of severe hypertension among non-Hispanic Black patients. From there, you can also take other very important aspects, right? Your hospital average rate of severe hypertension is higher than the state. How do you know that? Because you have the dotted line that is your hospital average and the solid line that is your state average. So immediately you know that your hospital is taking care of a higher number of patients with severe hypertension than the state median. So that is one take, right? And then you need to describe, when you disaggregate by race ethnicity, how you have a higher need in non-Hispanic Blacks. We also give you the ratios, and they are right here. For this particular hospital, they have a 1.8 ratio. And since it's more than 1.5, it's going to be highlighted in the background to make it more visually, you can see it more clearly. It's going to draw your eye. But from there, the most important thing that you're going to get from this is that the inference, what you're going to take from the graph and how you would write it up. So the first step in identifying these disparities is making sure that you can communicate the message to your team and to others as you build that plan. So for non-Hispanic Black women, we know that they have a higher likelihood of having severe hypertension in this hospital compared to non-Hispanic white patients. And that's the message that you need to write up when you start to put together your written action plan. Now, there may be other indicators where you don't see much of a problem. Depending on what you're focusing, differences can still be significant, right? So it's crucial to remember that depending on what you are working on at your facility, you can still use the disaggregations to find opportunities. In this particular example, the gap is not huge, it's not highlighted, but we can still say that for non-Hispanic Black women in this particular hospital, they have a 20% higher likelihood of undergoing a cesarean section versus non-Hispanic white women. Always remember that the reference group is going to be non-Hispanic white. So when you compare those rates, that's going to be compared to non-Hispanic white women. All right. So now that's the dashboard as a whole. Yeah. When you view the report, you'll see the graphs together in one page, and you can see across. And once you identify the ones that you want to focus on, our suggestion is that you continue to go into the additional pages that the report has, so you can get the additional information that you can get. And we're going to have an example next. This is one of those graphs. This one is a time trend analysis. If you think about it, it's going to give you the percent of the percent of cesarean deliveries for this particular hospital from 2018 all the way to 2023. The black line is the hospital percent. This hospital did so much work on NTSB cesareans in 2019, and you can see their drop. They went from 24.3 to 19.7. They standardized a lot of their practices, amazing work. Then COVID hit, and a lot of their processes had to be changed because they got so overwhelmed and their capacity was so full that they had to let go of many of the practices that they had established in 2019. Their rate started to go up, right? And you can see that how now it's higher than the median for the state. So once they, figure out that they had a problem, when they look at the disaggregation, that was really heartbreaking. If you look at 2018, they had a gap in between that was there, but it was not huge. Non-Hispanic, Hispanic patients had the highest rate, followed by non-Hispanic Black, and then non-Hispanic whites had the lowest. In 2019, when they standardized all their processes, that gap almost got eliminated. It was something to really celebrate. And that we know from quality improvement, because race is a social construct, is not based on any type of biological nothing difference. We know that when we standardize our practices, those gaps get better. And so in 2019, this hospital proved that. That was a beautiful, beautiful change. Now with COVID, those gaps are starting to widen. And all of a sudden in 2023, they have a huge problem. They have an emerging issue. And so now they are, working a lot in making sure that they go back to the standardized practices they had prior to COVID to fix this. And also they are making an evaluation to understand how and why their non-Hispanic Black population is being the most impacted. So this is what we need to do. When you go into your PQI report, think backwards. What changes may have impacted your rates if you are seeing them substantially increase? Or if you are working on them and you don't see improvement, what issues can there be in the system or in your population? Or they may be changes in your population as well, right? That may impact your outcomes, and they may need additional resources, additional programs to make sure that you see the changes that you want to see in your outcomes when you're working in quality improvement. So the idea with PQI is that you will be able not only to see your trends over time, but you will be able to see them disaggregated by race, ethnicity. If you're looking at the report online, you can disaggregate by insurance, by education, by BMI. So there's a lot of patient characteristics you can disaggregate by. You can find those issues, you can write them up. And once you identify, that's the very first step for your written action plan, which is one of the requests we've made for MFC. In the online report, you can also choose the NICU level that your hospital is part of, and that will readjust all your rates. You'll be able to see and compare your hospital only with those hospitals with the same NICU level. And if you want to see all your data in this page, let's suppose for non-Hispanic Black, right? You can just click on non-Hispanic Black here, right here, and everything will get adjusted. So if you wanted to see your non-Hispanic Black rate and compare that to other hospitals in the state, see if they are seeing the same increase that this particular hospital has seen in 2023, they can do that. So again, use your PQI report for writing up your needs and understanding that that is just the first step, right? Supporting and identifying disparities in care is one of the biggest aims of PQI, but that's about it. From there, you need to work with your team to draft those action steps that are going to address that health disparity. You need to find some interventions that may help specific populations, evaluate why some issues may be impacting some populations more than others, and possibly, change some policies around those things. For MFC, what we ask that you include in your written action plan is a definition of the healthcare disparity that you have found, as well as a specific population that you're going to focus on. That you establish an improvement goal, that you list the strategies and resources needed to achieve the goal, and that you have a process that will be used to monitor and report progress. So it's very important that you set up a measure that you will follow up over time to make sure that the strategies and things that you are doing are working. And this is all aligned with TJC accreditation requirements. So we are just working in conjunction with what's required for accreditation. All right, so that was the first section. I'm gonna break here for a second. I'd love to hear if you have any questions or comments so far. Tammy, who sends out the PQI report and when do they get sent out? The PQI report is sent out by the data team here at FPQC, so either myself, Ben, or Shelby. Previously, it was sent by our Director of Operations, Linda Dedman, but now we are sending it out. The liaison is someone that was assigned by your hospital. So if you don't know who that person is, please email us and we will share with you who that person is. And we usually send it twice a year. Our schedule is usually December and June. This year we send it out in January because we had a delay in receiving one of the data sets, and we really wanted to give you as much information as we can on those reports. So that went out in January. And the next time we send it will be June. Those are the two times that you will get a hard copy, a PDF of the report. But you can truly access your report online at any time, and it will be updated. If you asked us to have that for you, we update it every quarter. Every 3 months, you will get an updated report that you can look at online. Any other questions? Oh, Tammy, go ahead.
Yeah, I'm the new liaison. So I just finished doing all of the PQI modules. So I'm not sure where to go to find it online, and how do I make sure that I'm on that email list to get that report?
Wonderful. Those are great news. Thank you, Tammy. So we will reach out to you. I need to make sure that we have your email, but that's how it goes. You know, once you define a new liaison, they need to go through training. It's 30 minutes. The videos are pretty short. And once you complete those videos, just email us and we will add you to the list and send you the report. So we will follow up with you, Tammy. Thank you so much for letting us know. Any other questions? Oh, I love it. You drove out your email. Thanks. Okay, I don't see any other questions at the moment, so we're gonna move on. Go ahead. And next, I think we have Ben.
Thank you so much, Estefania. Thank you for taking us through that driver of data insights. Today, I just wanted to take us through the primary key driver of universal social determinant of health screening and linkage to services and resources. So screening all mothers for social determinants of health, assisting and referring mothers to help meet their needs, and successful and respectful way of working with community partners. So in order to do that, we're going to facilitate how to screen all mothers for SDOH using a standard process and format, and trying to link patients to available services and resources for all of our identified SDOH using our community resource directory and other referrals. And again, as a common theme here, respectful care is a universal component of every driver and activity in MFC. So to start, I wanted to take us through our universal social determinant of health screening. So far, this is one of our main aims, and I think that we have had great success with this. If you look in the third quarter of 2023, when we started, we were at 46% of all of our patients being screened. You see, we've had a pretty big increase, over 30% into quarter one of 2024, where we now have 82% of all of our patients in our MFC hospitals being screened for social determinants of health. If you look over on the bottom right, this is a distribution. So this shows the percentage of patients being screened, and it's by hospital distribution. The boxes that you see, that is our interquartile of 50%, so the median of our hospitals, the bulk of them, and how they're doing with screening. You see in the third quarter, that box is very big. There's a lot of variation. You know, some of our hospitals don't have screening in place yet, and some do. If we look into quarter one of 2024, we could see that that box starts to shrink. A lot of our hospitals have screening in place now, and it's being reflected with our data. And then something that we really like to see, 9% of all of our screens have resulted in a positive SDOH screening. We see that this is very close to the national average. We looked that up, and it's around 10.5% estimated. So we're close to the national average with the percentage of positive SDOH screenings. So the results we're getting are generalizable. Then if we look into referrals to appropriate services, we see that this runs a lot in the same way as universal screening. So the more patients we're getting screened, the higher percentage of patients are being referred to appropriate services. So in quarter three, we started at 52% of all of our positive SDOH screens being referred to appropriate services. In quarter one of 2024, we now have 78% of all of our positive screens being referred and linked to the proper resources and referrals. Again, in the bottom right, this is our distribution of referrals by hospitals in the initiative. Quarter three and quarter four, we see that that box plot doesn't really move too much, but we do see in the first quarter of 2024 that we have a lot of processes in place. Now, looking at it based on patient data is one thing. One thing that we also like to look at, though, is how all of our hospitals are doing structurally and the processes that are being put in internally. So it comes from our hospital level measures. I'm sure all of you have heard me say this a bunch on the coaching calls that it's so important to update them. And I think this really reflects the data that we're being seen submitted. So on the left, we have the implementation of a protocol process or guideline for screening patients for social determinants of health during delivery admission. In this, at the baseline, which would have been Q3 2023, we see that 69% of our hospitals had some level of implementation for this structural measure. But now we see in Q1 of 2024, 93% of our hospitals in mother-focused care are at some level of implementation with the structural measures. So we have 93% of hospitals that are implementing a guideline for screening patients for social determinants of health. On the right, this is the referral patients portion. So as you see at the baseline, again, very similarly here, we have 68% of our hospitals at some level of implementation for putting in a protocol process or guideline for referring patients to available community resources and services. Again, in Q1 of 2024, we have a pretty large increase. 90% of our hospitals have some type of protocol process or guideline for referring patients to available community resources and services. So just a big round of applause for all of our hospitals here that have been putting in amazing work so far in the initiative. All right. So one of the things that we also like to monitor as well is the unknown boxes. So something that we had at the beginning of the initiative, because we couldn't expect all of our hospitals to have the capacity to know all of our number of total patients screened, total patients screened positive and referred, we added an unknown box. And at the beginning of the initiative, as you could see in July 2023, 43% of our hospitals have been using that box throughout the initiative. And that's at our baseline, so that was expected. You go into December of 2023, and we are all the way down to 10% of all of our data submission having those unknown boxes checked, which has been great work so far. One thing we have noticed, because we are data oriented, is that since December of 2023 into the start of the year, we are now back up to 18%. So we've seen an 8% increase during that start of the year to now. And so we just wanted to kind of note that for everybody in the presentation, that if we can get the measures that we need and the numbers that we need, to make sure that we do that. All right. Now we get to go through some of our individual patient level data where we look at our number of positive screens in each domain and the percentage of those screens that are being referred to appropriate services. As you see here, most of our domains have around a 50 to 60% referral rate in there, and this is in the individual screening. But we do see that housing insecurity seems to have some struggles so far with the percentage of positive referrals being positive SDOH screens being referred. Currently, across the course of the initiative, we're at a 24% referral rate for this domain. And we understand that this is kind of a big issue all around, maybe not even just in this initiative or the state of Florida, but it seems to be a national issue as well. So you can see this over time as well, where we look at all of our domains by referral rate, food insecurity, interpersonal violence, transportation needs, utility needs, and other needs. They all seem to be kind of moving in the same direction. And I know one of the things we talked about in Estefania's presentation is differences between groups. So here we have 5 groups that are moving almost synonymously and increasing at the same rate, but we still do have housing insecurity that has quite the gap between the referral rate of that and all the other groups. So I wanted to open up a poll and ask what challenges you are experiencing in referring patients with positive screening for housing insecurities. Estefania, can you launch that poll?
Let me make sure. Hopefully. There you go.
All right. And I can't see the answers, so if you could read them aloud, if anything.
So you got a question there. The options are resources not available, resource directory not available, resource has waiting list, patient refuse, other. And then if you say other, we would love to hear what other challenges you find around housing insecurity.
Yeah. And again, we understand this is a big issue, and we are truly just trying to gain information from all of you.
We're going to keep it 10 more seconds open. Please make sure that if it opened up in your computer, you give us an answer for this question. We appreciate your feedback. All right, I'm going to end it now. Going to share results so everybody can see them?
Yeah.
Sure. Are you able to see them now?
I'm unable to see them on my end. I'm sorry.
No? Okay, no worries. So 28% said the resource was not available. 11% said the directory was not available. 17% has a waiting list. 33% found that patients actually refused the service. And we had a few that responded other. And let me see the details to see if we can find additional insights in there. But it's interesting to see that the majority actually mark that the patient refused the service. So they may have screened positive, but then refused the service.
Thank you all so much for the feedback and the insight. All right. And so now we're moving into our other needs. And so we were just with housing insecurity. And as you saw, this has the number of positive screens, but it also has the percentage referred. One of the things that we wanted to touch on is if you look in all of our boxes, the highest number of positive screens that we've had so far within the initiative have actually fallen under the category of other needs, which is kind of unique. It's not within the 5 main domains that we're all used to hearing about with food insecurity, housing insecurity, interpersonal violence, transportation needs, and utility needs. But it seems for us, the largest category is actually made up of other needs. And so what is the breakdown of the other category? So before we go into that, I wanted to launch another poll just to keep it interactive. How often are your patients screening positive for a social determinant of health outside of the 5 main domains? So it's definitely something we've noticed. We wanted to see if you all have noticed it within your hospitals as well.
And the options here are never, rarely, sometimes, often, and always. Okay, 10 more seconds. All right, I've closed it now, and here are the results. The majority of people about half of our responded said sometimes, followed by often, rarely, and never. So pretty much what we've seen.
Thank you all so much for your responses. All right, and so from our end, this is what we have seen making up that category of other. So mental health seems to be the major thing in this group. More than a quarter of all of the other needs screenings have been categorized as mental health related. 16% of this group has been used as substance use disorder. And the other predominant ones would be physical activity, financial stress, resources for the infant, and other categories as well. But we find this very, very interesting, and it's something that we look forward to exploring more throughout the initiative. All right, so now we go over some successes and challenges that we've had with screening and referral. Our first success is that universal screening practices have been implemented across the initiative. Again, we saw that in that Q1 of 2024, 93% of our hospitals at some stage of implementation was screening all patients for SDOH. We see that referrals as well, we've had great success with that, not only with our actual percentage increase in our trend line, but also with the structural measure being at 90% implementation here in the Q1 of 2024. As we know, in January, we all had to get ready for the CMS protocol. Because we started in July, it may have been advantageous as a preparation piece. An identification of other domains. Sometimes it's not the things that you think you're looking for. In our case, we had a ton of other needs screens. And for us, it's really great to be able to explore that and look into that in the future. and some challenges that we've noticed. So unknown in the data collection, since the start of the year, we have had a higher percentage using that unknown box. So that's been kind of a recent challenge. A decline in the percent of patients that screen positive for SDOH from 2023 to 2024. We have seen that over time. In 2023, we did have a higher percentage that screened positive than in 2024. We just want to make sure that patients feel comfortable and that they can open up about any needs that they might have. And resources for housing insecurity. I touched on this earlier. It's not necessarily something that's just initiative specific or state specific, but this seems to be kind of a national issue with housing insecurity. And it's definitely going to be a challenge with social determinants of health moving forward. And now I will pass it to Shelby.
Thanks, Ben. Appreciate it. Hello, everybody. Good afternoon. My name is Shelby Davenport, and I've got two more drivers to dive in with you guys today. So the first one is family and community engagement and hospital QI work. So the best practices we see to achieve that primary driver would be first, educating your QI team and leadership about what family and community advisor involvement looks like, and then strategies, how we're going to achieve that, how we're going to find someone. And then the second part would be actually to engage that family and or community advisor as a part of your QI team and every step of the way of the work that you do at your hospital. Next slide, please. So how are our hospitals doing on this driver, this implementing strategies to educate about family and community involvement? Well, 44% of hospitals are currently implementing some kind of strategy to educate. So this is great. This is a 20% increase from baseline. So we are going up, but let's dive a little bit deeper and separate this percentage and look at family and community involvement. So next slide, please. So on the left, you can see the percentage of hospitals that are engaging a family advisor. We've gone up slightly from baseline, but right now we have 18% of hospitals are actually engaging a family advisor. And on the right, you can see now in this Q1 that we have 34% of hospitals engaging a community advisor as part of their QI team. So that number is still pretty low. We still have some improvement to go. But the good news is for those that have not started or planning, it would be a great opportunity to seek out those that have implemented these partners, maybe at coaching calls or other circles, because maybe a community advisor is like Healthy Start and they're already at your hospital. A lot of times that family advisor takes a little more effort to find. But yeah, we'd love for those that have started implementing to share those strategies with our other hospitals at your coaching calls so we can continue to grow this green bar. Next slide, please. And lastly, I wanted to cover the respectful maternity care driver. So the best practices we see to achieve this driver would be first, educating providers and staff about respectful maternity care practices. Developing a commitment with those that have received the training. So that everyone's on the same page about what a shared decision-making model looks like and what respectful maternity care will look like in your hospital and on your QI team. So on the next slide, we're gonna dive a little bit deeper into this. So here's our first aim highlighted at the top for you. We hope in 9 months from now that we'll have 80% of providers and nurses attend a respectful maternity care training. So right now, since January of 2023, we have 48% of nurses that have attended this training. So half of nurses are leading the pack, and physician and midwives have about 20%. So both areas have a lot of room to grow, but we're hoping those trailblazing nurses will pull in their provider and midwife partners. And so hopefully we'll see that these numbers continue to grow as well towards that 80% goal. And then also I mentioned once you've taken the training, we then hope that these QI teams will create agreed upon plan for shared decision-making models between their team and their patients. So right now, nurses, again, are leading the pack at about 50%, 48% right now in this quarter, and 38% of physicians and midwives. So of course, we'll see this number continuing to grow with more people utilizing that respectful maternity care and spreading that knowledge throughout their QI team into the rest of the hospital. But does anyone have any questions about respectful maternity care driver or the family and community advisor? Or yeah, if anyone has like a effective partner that they found in the community, maybe they'd want to share that as a comment. If not, no worries. You have that chat box, so you're more than welcome to use it.
Please do. If you have any questions and you'd prefer to type them in, just drop them in the chat box. I do have to do a little plug today. The day before of the in-person meeting initiative meeting, we are hosting the Respectful Maternity Care the trainer program. Nicole and Dr. Brumley have gone through the state doing the training. They are amazing. And they're going to be doing an additional one prior to the meeting initiative meeting. So you saw how we still need a lot of education on RMC training. We have gained some, but definitely for physicians, midwives, we need a lot more effort. So if you have a train the trainer type of person in your team that would be a good match for the trainer program, please make sure to share that information with them and have them attend. For the community partners, Shelby was telling you all about, how you can involve your Healthy Start partners. A lot of these things are very heavy lifts. We know you shouldn't be trying to do them all by yourself. Housing insecurity is such a big trouble. It's such a big issue in the state. And your Healthy Start partners should be trying to tackle that issue with you, trying to think of ideas outside the box to make solutions and to help you through that. So make sure that you are in good connection, working together with your Healthy Start representative. If you need us to make a connection, let us know. We're more than happy to make a connection if needed. I don't see any questions at this time, but before we move on, is there any other question at all?
Could include screening and referrals, anything.
Yeah.
I have a question. This is Nell from Bethesda. How are you guys?
Hey, Nell. Good.
Hey. Is this presentation available? Because I think some of my leaders are not able to attend. So where can I find this presentation?
That's a good question, Nell. I know the slides will be available after the meeting. We usually put the recording up in the website a couple of days after. And we follow up with an email to let you know that the recording is available. So you should be hearing from us in a couple of days about the recording.
That'd be great. Thank you so much.
No worries. All right, I think we can move on. So throughout the presentation, you've seen that we tackled each one of those drivers that we set out to change. On the data insights, we realized that most hospitals now have a process in place for demographic and SDOH intake, which is fantastic, but we still need to work on that written action plan to address a health disparity. On respectful maternity care, most hospitals have a strategy in place to share respectful care practices with patients and providers, but we still need some education on the physician and midwife end. For the universal SDOH screening and linkage to services and resources, we have seen an increased SDOH screening and referral. We actually met goal. It's really fantastic to continue to see that time trend going up over the quarters and months. So thank you so much for implementing that fantastic practice and doing such great work. As we go on in the initiative, we just want to ask you to always be mindful that those linkages need to be meaningful. So when we set out to start the initiative, we all understood and agreed that that one handoff is more than a brochure, is more than a list of resources. It has to be, something that is meaningful for the patient to address their needs at the moment. And many of you have shared in the coaching calls how you have been able to secure food packets for your patients, that you have been able to secure temporary housing through different venues. So absolutely significant, meaningful connections, and that's what we need to continue doing. For family and community engagement in QI work, we know that we need to continue to engage advisors, for both family and community advisors in the QI work. And we hope to see more examples in the future for you. Next slide. So what's next? We do have our Meet Initiative meeting 18 days from now, a little more than that. But we really want you to be as prepared as you can for the meeting, because we're going to have so much discussion, and we need you to bring forward your challenges as well as your successes, so the collaborative benefits from it. The very first ask is going to review your data reports with your team and identify those challenges and opportunities. For this initiative, we actually have 3 reports. You have your PQI report, your QI monthly report, and your Respectful Maternity Care survey report. So please make sure that you review the most up-to-date. You will receive the QI report tomorrow, and the RMC survey report next week. And if you haven't seen your PQI report, please email us. We're more than happy to connect you with your liaison so you can have your PQI report, so you can review it all and you are as prepared as you can be for the Meet Initiative meeting. We really want you to share your concerns and barriers regarding family and community advisors in your QI team. That's the measure that we've seen the least track on. So please, come ready for that discussion. And we also want to ask you to make sure that you have at least 2 people registered for the in-person meeting. And as you come, to please bring your bling. We'd love to see the beautiful materials that you've created for your patients, for your providers, for your hospital. You all do tremendous work, and we all want to just celebrate all the amazing ideas and work that happens in the States. So bring all those things. We'd love to see them. All right. Next slide. So evaluation time. I'm going to launch a poll. Let me see. And it's just asking you how this went, how we can improve it. Let's see. Oh. Give me 1 second. Ben, are you able to see the poll on your end?
Oh. On my end, I am not.
You're not. We will have to follow up via email with the link to do the evaluation, because the poll is not come. Oh, no. Let me see. No. The system is not allowing us to launch the poll. I am very sorry for that. Let's see, last attempt. No, it has blocked the launch of the poll for some bizarre reason. But it's okay. Go ahead.
One of the issues could be go to the last poll we launched and then make sure you stop sharing it. We had that issue come up recently.
Oh, really? Okay,
Yes.
that's really good feedback. Let me see. Fingers crossed. No. Ben, you're a genius. Thank you so much. Little technical difficulty, of course. All right, guys. So please, if you can scroll down, we do have some questions regarding this session. We always want to know how to improve, how to make things better, how to make them more valuable for you. So please let us know how we can do that. Once you go through the 3 questions, please make sure to hit submit, and we can talk a second more about it. Ten more seconds. We'll leave it open for another 15 seconds because I still have answers coming in. Thank you for your patience. All right. Wonderful. Thank you so very much for your feedback. If there are any remaining questions and you'd prefer to email us, our email is fpqc@usf.edu. Please remember there's a realm of information and resources in our toolbox for the MFC initiative. That's our website, and you just do -MFC to go directly to the initiative's website. We do have social presence throughout. If you would like to follow us, that'd be amazing. Other than that, that's all we had for you today. Thank you so much for joining us, for your participation and engagement. And we look forward to seeing some of you on the 18th. Have a wonderful, wonderful afternoon. Thank you all.
Thanks, y'all.